Dr. McNamara here. Today I wanted to talk about one of the most common causes of dizziness or vertigo, and that is known as BPPV. BPPV stands for benign paroxysmal positional vertigo. BPPV affects around 2.4% of the adult population, but it's typically going to be more commonly seen in the elderly as well as in females more than males. BPPV also has a very high reoccurrence rate, in which about 50% of patients will experience some sort of reoccurrence within the next 5 years of when they first develop these types of symptoms. And this is a very, very common cause. About 17 to around 42 to 50% of dizziness and vertigo cases seen in the clinical settings. So what do you do if you have or you are experiencing BPPV? One of the more common canals that are affected within the vestibular apparatus is the posterior canal. So when it is the posterior canal that is affected, we do something that's called the Epley's maneuver. We perform this in the office all the time, but for those of you that don't really have that option to go into a clinic and get this procedure done for you, here's how you do it on your own, okay? So first things first is you're gonna wanna get a pillow to go underneath your shoulders when we lay down, because that's going to cause around 15 to 20 degrees of neck extension, and that is very, very important when performing this maneuver. So first things first is get the pillow in the position, and then you want to lay with your feet extended, your legs extended. And then to start, you're going to turn your head to around 45 degrees, and then you're just going to lay back. And then the pillow should put your head into a little bit of extension, okay? Now, from here, I'm going to hold my head in this 45-degree angle for about 30 seconds to a minute, okay? You may or may not experience some dizziness during this portion. After that 30 seconds to a minute is done, we are then going to rotate the head 45 degrees the opposite direction and keep it extended. Okay? Again, I'm going to hold this position for 30 seconds to about a minute, and then we'll move on to the next step. And for the next part, we're going to go up on our side, and then you can put the pillow underneath your head so it's more level at this point. And then we're going to lay on our side again for 30 seconds to a minute. And then once that time is up, we will then lift up ourselves and then remain seated, head straight for another 30 seconds to a minute, and see if that dizziness clears up. If it doesn't quite clear up, or if there's still some lingering 10 to 20% left of that dizziness, go ahead and perform the procedure again and see if that clears it up. Now, the way this procedure kind of works is, when it was explained to me in school, is inside our vestibular apparatus, we have these things that are called otoliths, and those otoliths are responsible for telling our brain where our body position is in space. So what happens over time is, what our teacher would say is, imagine you took a piece of tape and you stuck it on some sand, and then you stuck that tape on the wall. You can imagine 20, 30, 50 years go by, eventually some of those little pieces of sand are going to fall off of that tape, and that's essentially what happens in BPPV. Some of those otoliths, they start rolling around in that circular canal, and we feel it when we start moving our head and our body, and it sends us mixed signals of proprioception. So what this maneuver does is it replaces those otoliths so they're back in the position so they can re-stick within that vestibular apparatus and reduce these symptoms from occurring. So guys, give this maneuver a try if you're experiencing any sort of vertigo or dizziness. And if you like this type of information, please like and subscribe for more health and wellness. Thank you.